Hello everyone, welcome back to the channel. This is Dr. J. I have a 4-case compilation for you today. The first one is a scenario where a patient was sent to me because the primary care provider looked in the ear and wasn't quite certain what they were looking at and wanted to make sure they were okay. As you can see here, can you guess which ear this is? This is the right ear, and this is what we call the obstructing curtain. In other words, there's something obscuring the view, or what would be a typical view of the tympanic membrane. As we look inside, it's and under magnification, we can clearly see that this is some old wax that's attached to some old skin, utilizing Takahashi forceps. Sorry, not Takahashi forceps. That's a sinus instrument. The alligator forceps. We can remove this without too much difficulty, gently pulling, because sometimes when you start to pull away that skin, sometimes it can be a little uncomfortable for the patient. So you start with a real gentle pull, try and pull it all out in one shot, and here it comes. You can see the cerumen ring as well as some loose skin attached. And looking back in the ear, we have a normal view of a normal tympanic membrane. And they were sent back to their primary care provider without any concerns. This is the second case, and this is just a classic golden brown cerumen plug. As you can see here, this is the left ear. Maybe during the cases today, you can kind of question how well you can judge which ear we're looking at. Once you get the basics down, it should be pretty obvious for you. This is a patient that I believe came in for cerumen cleaning and was slated for ear molds. The audiologist will need to make impressions of the ear canal, and then from that custom build some ear pieces as a part of their hearing aids. And in order to do that, their ear canals have to be free of bulky debris. And so once we get this out here, you can see this was fairly sizable. It wasn't completely obstructing or affecting the hearing, but it was inhibiting them being able to put an ear mold in. And here comes the plug, a little bit of hair, and I didn't give you a last view of the eardrum. You'll have to trust me on that one. That one looked like a normal eardrum as well. This is the third case. This one we're calling the frustrating fragmentation. The reason for that is, as you see here, as we zoom in a little bit, that it is completely obstructing the canal, and we can tell that it's just visually that it's going to be a difficult removal. It looks very hard and impenetrable. So we start the soak with some Colace, and we're going to get rid of a little bit, or try to get rid of a little bit of loose skin around the edges, trying to manipulate the plug, but it's not moving. It is stuck. So I'm using a right angle here, and when you use an instrument like this, you sometimes can get a purchase and you start to pull, and as I'm starting to pull, I'm using a lot of force, and you start to see the wax plugs start to fragment. And so I back out. I don't want to fragment it if at all possible. It's much nicer when you can get these out in one big piece. Once it starts fragmenting, then it just it becomes kind of a disorganized mess, and you just wind up picking up bits and pieces. It's less satisfying for the provider, and sometimes will take a little bit longer of a procedure when you start having to deal with fragmentation. But no matter what angle I approach this plug from, it's just not willing to move very much. And on those, and you can see here, I'm starting to move the plug, but it's still not going to come out as a whole. And so I apply some more Colace, and the goal with this now is to try and lift up the plug again so that Colace can get to the back and around the edges. Just looking for a little bit of lubrication between the plug and the skin canal. The skin of the ear canal wall. And still, it's just not budging. And so at some point you got to just make the decision to start to break it up and start to remove it. And so we're going to start that process here. We know it's going to fragment now, and it's not going to come out as one big piece. So we're going to break it up into a few pieces here, and always start from the edge and work your way in. You don't want to start in the center and work your way out. When you do that, it's more likely to potentially hit the ear canal wall, which is very sensitive. And those patients never come back. It was too painful of a process for you. So you always start from the outside and work your way towards the middle. And you can see here this wax plug is jam-packed full of hair as well, forming this concretion. And when you start to pull on that, you're not sure if if the hair is still attached or if it's loose hair. So you kind of gently start pulling on it, and because you don't want to pull those ear hairs, because those can be real sensitive as well. You can see here the whole plug is moving, but it still won't move out of the ear canal. And you'll see why here in just a moment. I'll point that out here. But we're still getting some fragments out, and using the right angle here, we're getting the last few bigger chunks out. Now that was the last big piece. We're starting to see clearance of the ear canal. And then this attachment of wax and old skin here, as we start to elevate it up, we got one more smaller fragmentation with the alligator forceps. And then as we're pulling this out, you can see why it wasn't moving before. This wax and old skin ribbon, that's what was holding it in place. Now once that was out, then that was the root cause of why it was so stuck in there. I got that little hair out too at the end. I don't have that on video, but you'll just have to trust me on that one. So moving on to the last case, this is what we call the never-ending wax plug. It's the look of it. When I look at this plug, I can, based on experience, I know that this is likely going to fragment as well. I want to do my best not to fragment it. So we test it there with the Fraser suction. We apply some collace. The wax plug is going to now start moving a lot easier. You can tell by looking back that the whole thing looks like it's moving as a whole. You never quite can see with a plug of this size what's going on behind it, but it looks like it's manipulating very easily. So reach in with a shortened right angle, and with those I can get a little bit deeper in the canal, and it's a little more maneuverable. And you can see there that little piece that we just started to fragment off. So I immediately move away from that and try and get a better purchase from a different angle. Working on the bottom of the ear canal there, and then I go back up, and we're just kind of stepping our way out a little piece at a time. Just a little bit of advancement with each maneuver. There we go. Now we're starting to get some good movement there. If I were to penetrate any deeper into the wax plug, it would have fallen apart even more. Well, here with a broader view, the biggest portion of this plug comes out. Now, the reason we call it the never-ending wax plug is because what's coming next. So that's a fairly large piece. As we get that out of the way, we look back in the ear canal, and there's more of the same. A little bit darker, which is going to tell us that it's been in there a little bit longer than the outer portion of the earwax. We can see that the collace has gotten deep and it's plenty lubricated. We just have to get a decent purchase on it to be able to get it out. And as we get this last piece out, there we go. Get the right angle back in there again. Again, this is a shorter right angle. Allows a little better maneuverability when you're deep in the canal like that. And here's the other plug, and you can already see in the background there's more. It's almost like an infomercial when they say, but wait, there's more. There's that plug, that one's gone, and now one last piece way down in the anterior sulcus. I'm using number 5 Fraser suction here to get down in there, and there it comes. The collace worked perfectly. That was plenty lubricated, and a good view of a normal, healthy eardrum. And that's it. That's all for today. Thank you very much for all of your support, and have a great day. We'll see you on the next video.